welcome once again to TLC, Transforming Lives Continually. My name is Michael Stewart, and we talk on this program things that we feel would help you. Personal development, social issues, and also medical issues. And talking about medical issues, we've got on the program none other than the man himself, who is quite competent to be able to speak on the subject of medical issues. Today's program is called Aging and Health. Dr. Ogana Okike, internal medicine, and he's a specialist and has been one of our most reputed doctors here on the island. And so he's going to share with us on this subject. Welcome to the program, Doc.
Good morning, Mike, and Happy New Year to you.
Thank you very much.
Yeah.
And same to you. Aging and health. As people get older, some of the things that we ignored and we never thought that we would be dealing with, we begin to now grapple with as we age. Where would we start with that?
Okay. Well, as you get older, what's the definition of getting older? They say when the policemen start looking younger, then you know that you're getting
okay.
And sometimes we are in what they call denial. You know, as you get older, you start, because when you're growing up, when someone, let's say about, say, 18 years old, when they tell you someone else is 30, you say, well, that's old. Yes. When you're 30, someone who's 50 is old.
Yes.
When you're 40, somebody.
Yes.
So aging, but generally.
The thing about aging too is that when you are 8 years old, you really wish you were 12.
Good.
And then when you are 12, you wish you were at the age to get a license, 17. Right. And then at a certain age, you really start to now wish you were younger.
You're younger.
So it really starts going.
Hence that saying that youth is wasted on the young. You know.
Yes. And that's why we saying that.
So usually aging, you know, we usually talk about biological aging, and because some people never mentally age, they're always young at heart, as they say. Right. But biological aging, we're talking about people who are approaching their retirement age, 60, 65, 70, and so on. And there are definitely going to be changes that occur in life. You know, hence that saying, once a man, twice a child. All right. So just so that, you know, we don't miss too many things, I'll probably start from the head and we just go down. So let's start with the head. First of all, insomnia. Insomnia means difficulty sleeping as much as the body is required to sleep. Usually you want to have about 6 to 8 hours of uninterrupted rest at night. But as one gets older, they tend to become light sleepers. And when you're a light sleeper, anytime you're woken, it's difficult to go back to sleep. And for especially people who are getting elderly, probably they have to go and urinate frequently due to some other things like prostate, etc. Or some can't even go to sleep at all. Okay. So insomnia is one of them. The other thing in the brain is...
I thought that would have been because of issues that people have, or problems that they have, or things that they have on their mind and so on.
Yeah, no, but people are going to have...
It
comes naturally with age. It's difficult to get into the stage 4 sleep, which we call rapid eye movement sleep. Right. You know, as you get to something that just happens with age. So that's why they're light sleepers and so on. Now, the problem, obviously, as you get older, if you have worries, they're going to magnify because they accumulate over time. But
you have marital problems
and so on. But that happens to people even when they're younger and so on, and they can't sleep. But this one has its own biological issue as well. Not all the old people, but chances are, and you find them sleeping during the day, but that's one of them. The other thing that could also occur could be things like depression. Okay, and depression in the elderly is something that we all know about. It could be from physical ailments. We'll get into the physical ailments, which they have to deal with, feelings of infirmity. Could also deal with feelings of, you know, you're no longer in control, you know, you're now having to depend on other people for certain things. It could be for lack of fulfillment. You look back and regret you didn't do certain things, put certain things in place, especially if you don't have maybe a place to stay, or you don't have a proper pension, or you know, the children.
Some of your dreams.
Yeah, your dreams you missed out, or somebody, maybe children you thought would turn out a certain way, and they come back and attack you, or you know, property issues
that got them into trouble. And they now look back on it as set their lives back and so on.
Things like that. So that could be depression, or just the natural depression from just the infirmities, you know, which I'm going to talk about in a little while. So you have to take this medication, you have to take that. When will all this end? And then the fear of mortality, because your friends, relatives, people getting to your age are all dying, so you don't have the regular people you normally talk to. Right. So you kind of start feeling like, in fact, people start even looking at you as if, how come you're still alive?
Right, yes. And you begin to wonder if your shot will go just now.
Anytime. So you lose that before you're in control and relevant, loss of relevance could cause depression. As opposed to even there's some illnesses you may have which mimic depression, which even make you depressed, like thyroid problems, low thyroid, and so on, which we'll get into. So depression is. The other thing coming from the brain is forgetfulness.
Right.
What you call
insomnia, depression,
forgetfulness. What they call senior moments. You find as you get older, because the brain neurons over time they start getting old too, so they are not able to be clicking as they used to be. So if people start forgetting things, which people will say, but how could you forget that? So people become forgetful, and when you forget important things and you don't know you forgot, and someone keeps reminding you, keep realizing, you get frustrated, and that even makes you more forgetful, and so on.
So is this a forgetfulness that is temporary, or is that different from amnesia? Is the same thing, or is amnesia something where you forget something completely and never recall it? I'm not sure.
No. Well, amnesia just means that you had memory loss. It could be long-term or short-term memory loss. But this other one also comes with cognition, because you see, one of the things is lack of insight. With amnesia, you may say, they're telling you this and you can't remember it, as opposed to a routine you're supposed to remember. When they remind you, you're so, gosh, how do I forget it? And it also comes with cognition, because when people are telling you you're becoming forgetful, if you don't have the insight, you don't believe, they feel that they have been too controlling and leave you alone. People as they get older, they get fixed in their ways and their things. And so, and then there's part of it also could be due to some medications people may be taking. Some of it could be due to this thing they call Alzheimer's, which is what they call dementia. Multi, in fact, people who've had vascular problems in the brain, and so on and so forth. So, but those things, they say if you live long enough, you live long enough to get everything, So those things will then start coming in, and those could affect you in the brain. Also in the brain, you talk of things like strokes. As you get older, the blood vessels harden, so your your potential for having a stroke increases as you get older, so that not you're going to get a stroke because you're old, but that potential increases. Then still on the head part, we talk about vision. As one gets older, the eyesight starts to get challenges, people start becoming more long-sighted, they start having higher risk of getting cataracts and things of that nature. So visual problems like the glaucoma, you start hearing about as people get older, because the body, those functions, those physiological functions are starting to erode, and if it manifests in the eye, that could be a problem. When the eyes get drier and the eyeballs maybe shrink a bit, you find that ability to focus, vision, you may require glasses, so more people require glasses. Then that means that you might start requiring to have people drive you, you start losing independence because you can't go out at night, so you need somebody. So that additional thing could also add to depression and anxiety. Also around the head is the ears. Some people they could get hit by a car. They're crossing the road because they didn't hear the car coming.
Okay.
Their hearing started to diminish for certain frequencies. And sometimes there are some hearing issues that come with ringing in the ears. They start getting dizzy spells and so on. So those are some of the things I could mention that happen around the head.
So well, I guess you will come to tell us whether there's anything to delay some of these things that you're talking about.
Oh, yes.
Right.
Yeah.
Okay.
Well, I could talk a bit about what you could do to delay. First of all, how do they say it here? You take in front. In front take it. Some people try that, and sometimes it backfires. Because if you go, let's say for instance, you're doing a type of job where you hurt your back a lot and so on, you develop back pains long before your age, and then you might get a little bit, difficulties in your mobility. But then at the time you say you need to earn the money, they tell you to get rest. You said no, you need to do these things. Let's say you like to lime, to entertain, They say, some people say I like lime hard, So you go and drink a lot of alcohol and so on and so forth. You may then trigger other things at a young age. Because your youth would now try to act as a barrier and take all of these things, but it erodes, in other words, your reserves, which you would have had to go through your old age. You've taken up the reserves, so then you start manifesting things like liver problems, diabetes, things like that, much earlier than you would have if you had lived a healthy life. So by this you could see that if you live a healthy life, chances are you may not just elongate your life, but elongate your health, because some people are alive but not living.
Right. Yes.
And you want to live while you're alive. So we're talking of regular exercise, we're talking of eating the right type of diet, minimize alcohol, avoid smoking, you know, and then understand your family history and see what they are going through, so that you start early preventing things from occurring to you. The only thing you can prevent is a numerical age, but at least when you get to that age, if you hadn't take for instance, you have 2 vehicles. Let's leave out the human aspect. One of the vehicles is washed every day. It drives on the highway. It comes back. It's not always in a traffic jam. It's not pulling boat with 10, 15 people inside it. Okay, like a private vehicle and a government vehicle bought the same day. Right. Look at them 4 years later. They're both the same age, but one of them looks like it's 20 years older than the other, even though the number plates are the same. So same thing one could do with their health. You overrun the body, it's going to take it, but you're going to age faster in your body than the average person would. So that also, we're talking about physical overwork. Mentally too, if you're somebody who is maybe pessimistic, somebody who is, should I say, very, you know, you're always under stress, you're always under all sorts of negative things, you're not, you know, trying to be happy, you don't laugh, and so on and so forth. You also age because stress releases.
You could age physically by that mental state.
Yeah, because you're going to raise certain hormones, the hormones that are always dealing with stress, adrenaline, cortisol, those things are always preparing you to jump. You're an anxious personality. Those things could age your blood vessels, increase your you know, certain fats around the body. So those could age you inside. It's almost like having a sea blast going on inside of you with all of that. So that's why I say try and be cheerful, surround yourself with positive-minded people, laugh, try, tell a joke, you know, and try to have hope. Those things you could also see in, you know, when you go into, for those of faith, you go into church, you go into, for those who like entertainment, they go and take a holiday. Not a holiday to go and work some more, but a holiday to go and, so those things also help to delay health issues. Then, okay, so back to the physical aspect. Now talk about with age, arthritis, joint pains.
Right.
Okay, and that is really because the joints over time will start to erode the cartilage, and when bone starts rubbing against bone, you start having the pains. So
the cartilage, is that almost like a cushion that's between the two bones?
Exactly. So it is that soft, gooey, thickish thing. When you ever eating chicken bone, that thing at the end of the bone is cartilage. Okay. So the two cartilage, each joint has two bones at least, and there's cartilage at the end, and in between the cartilage there's fluid, what you call synovial fluid, and then there's fibrous tissue which encapsulates in the joint. So the fluid is like a shock absorber. Right. Okay. And the cartilage and the fluids, the two ends kind of glide against each other, so it's smooth. You know?
One of these days we probably should bring you some graphics so that you could be able to see exactly what is being spoken about.
But over time, even vehicles, the shock absorber goes, you change it, but you just don't change joints. I mean, you could, but it's called a joint transplant, and that's pretty expensive. So the fluid itself goes, there was a time when you had those liquid fluids, you had to change the shock absorber fluid. So that goes, then the cartilage goes and gets inflamed, it goes, and bone starts rubbing against bone, then pain comes.
What causes it to go? Is it just naturally aging that causes it to go?
It's used. When you're using something, it's not stiff, it's being used, okay? And then if you put in more work on it, like weight, so if someone is overweight, you're putting on, the body was designed to carry a certain weight, and then you put on, so you put more weight on it, so you bring that cartilage closer to each other, and they rub and they get inflamed. Obviously, if you damage the joint in an accident, a fracture, or whatever it is, the cartilage is going to obviously get damaged and will erode faster and hurt you faster as you get older.
How about it getting off of bed and putting a foot on a cold ground that our parents used to talk about?
Well,
you ever heard of that?
No, I've heard about that. Changes in temperature, it's not necessarily that the ground is cold, but a sudden change in temperature is perceived differently by nerves. So if someone already has an irritated joint and there are those sudden changes, they might appreciate a feeling of discomfort more. But even the one we are more can explain better those when the rain is coming. You know, some people could tell it's going to rain because they start having joint pains. What happens in those people? The pressure receptors, your joints, besides the pain, they also have receptors that tell you your balance. So your eyes could be closed, but you could tell that you're standing up. They have those receptors that link up with the brain through the cerebellum. And those joints also have pressure receptors in them. Remember when we did geography and physics, they have something called a barometer. It's pressure, usually atmospheric at sea level, pressure 760 millimeters of mercury. So you have those things that check those pressure. The joints in people who have arthritis are sensitive to pressure changes. And before it rains, what happens? Rain comes into a low pressure zone. So when the low pressure zone comes in, the joints will feel it long before the rain comes. And what you feel it as pain, it will rain today, and half the time you're right, and you think that meteorologists know it's just that effect they've had, and they've come associated with rain. Then as we go beyond the joints, you also talk about, so we could go down to the heart. The blood vessels harden as one gets older, and if you have other things like diabetes, hypertension, cholesterol, you're overweight, you smoke, your risk of having a heart attack increases. Okay? As people get older, their risk for high blood pressure also increases. So that is why you start advising people to avoid the salt, exercise, and stuff. If not, you have hypertension, and once you have hypertension, any number could play. With heart disease, heart failure, shortness of breath, those things could occur. As one gets older, the bowels get lazier. So talk about constipation, all right, which for some people is a problem. I haven't gone out for 2-3 days, and the toxins that they think they are feeling from that. So as people get older, we advise them drink more fluids and add more fiber to your diet.
Not going off also, would that also now cause other issues itself?
Yes, in an elderly person, when they get constipated, they could have altered mental status. And altered mental status means the person starts getting drowsy, less less energetic, or sometimes they just get withdrawal, and some people, that's the word, lethargic, and sometimes they might even be comatose.
Okay.
Yeah, in elderly, in fact, elderly people, any infection anywhere could make them altered mental status. Constipation is another thing that could do that, or even as far as a bladder infection, and even medication, because as you start getting older and you have ailments, you're going to put on medication, and certain medications, their side effects
is constipation.
Could be constipation as well. So, and could be a whole lot of other things. And what do they go and do? They go and take a purge, and a purge will also make the bowels lazier, which means that they can only use the bathroom only after having a purge. And then after a certain bit of time, it causes other bowel pathologies. They might start passing blood in the stool, they might, so constipation is an issue. The other one, which is not so funny, not that the others are, is urinary incontinence. They can't hold their urine. So you find the minute they feel the urge, before they go, they've wet themselves. How do they say it here? They pee the skin? Right. So they wet themselves. And that could be a problem, because as people get older, especially the males, the prostate gets bigger. And some people, if it gets bigger than usual, they could have problems with passing urine.
So you'll have the incontinency, and then you'll have the stoppage of water.
No, the stoppage of water could cause incontinence, because what happens is this. They can't pass urine, so the bladder just keeps filling, to a point where it gets so full that it has to come out one way or the other. It's because they go and pee, but they didn't empty out the whole thing. So it becomes what they call overflow incontinence. Separate from, also, when you don't empty it all the time, any residual one could get infected. You get a bladder infection, and when the bladder is irritated, when it's infected, it gets irritated, and it does not contract. It forces you. It overrides your control. It overrides your control. Okay, so as a result, you find that it could be a bit of a problem. And then sometimes people are on some water pills for blood pressure control or for heart failure or something else. That means that they will want to pee all the time. So incontinence becomes an issue for the women. Even though they don't have a bladder problem, as they get older, when those hormones, they go into menopause, those hormones, estrogen, progesterone, go. Certain tissues around there start contract. The vaginal tissue gets thin and laxer, and sometimes the uterine ligaments get lax, and the uterus tends to prolapse. And when it prolapses,
explain that prolapse.
Prolapse means something that is dropping. Normally, ligaments will hold something up and hold them in the anatomical position. When the hormones that keep them strong and elastic are gone, those walls get weaker. The ligaments get weaker. But the womb is the same weight, so it starts to it starts to lower itself. And attached to the front of the uterus is the bladder, so the bladder starts inverting with it. So you find that the bladder is no longer could fill the normal size. It's always under tension. So any urine that comes into it, and then the muscle that they can use to hold on to what they call the urethral sphincter. That's what they call it. Because the uterus has prolapsed, it pulls that muscle out of the control of the person to hold it back, to voluntarily hold it, and they can't do it, so they become incontinent. So age itself with menopause could cause urinary incontinence. Is there some
exercise that could be done to keep that elasticity?
Well, there are exercises that have been suggested that people could do, but it depends on what's causing your own prolapse. Sometimes people have even had surgery that affected certain things they do. Sometimes they may have some big fibroids, other things are going on, and sometimes some people's menopause worse than others. So exercise you could do, but ultimately they could put up certain pessaries that could try and hold it up, or you may go surgically to have the ligaments, what they call a Manchester repair. They can have the ligaments strengthened, but I'll leave that for the gynecologist, right? So that could also cause incontinence in the elderly. So I just a synopsis of what people go through as they age.
More problems than one thought.
No, I could go on and on.
Challenges.
Okay, because I haven't even talked about chronic non-communicable diseases, which is diabetes, hypertension, and high cholesterol. Diabetes and hypertension.
But what we want to do is to probably put that on the next program, because that one is going to take up a big.
No, I just wanted to mention that those, as you get older, you get to see everything. So your risk of developing diabetes depends on how long it takes for what produces insulin to your body to start getting too tired to produce anymore. So when you're born, you have a certain amount it's going to be producing, but it starts to decline. And let's say it has a certain level which it has to get to before it's not enough. Maybe that will happen by the time you get to age 80. So if you die from something else at age 60, you say you never had sugar. But if you live probably to age 80, when you wouldn't be able to produce that, then the sugar shows up. So that's what I mean, that with age things are declining, and it depends. So, but if you overuse your pancreas from drinking too much alcohol or doing things like that, you may develop the sugar a whole lot earlier. You're overweight or things like that. High blood pressure, you can't really run away from. Your pressure goes up, but it may not go up to the level of constant high blood because the blood vessels are getting thicker and thicker. Now, under course of depression, I talked about depression. Now, depression could be from any of these things we've listed, whether it's the arthritis, whether your vision is going, because at the end of the day, you're going to have to depend on people. And if you come from a family where there's not much support, then you're going to be depressed because they're not going to help you, And for the men, the other issue has to do with sugar, high blood pressure, and sometimes by age itself is erectile dysfunction. Some medications they may even be taking for high blood pressure could also cause that as well. So as you get older, with all these things coming on medication, you could have other things, and maybe that's the only aspect of life that he had left that gave him reason to live. Depression goes because
as you're speaking there, I'm wondering, why does loneliness, where you had all your children, you had your husband or your wife, the children are now grown, living elsewhere, and husband or wife now deceased, and they're alone. Does that have anything to do with your medical condition? I know depression might be one, but does that have anything to do with dementia, anything like that? Your mental state?
You mean when people are bad?
That loneliness, whether it could affect you.
Loneliness is going to give you depression, and once you have depression, everything else, the whole body changes. Anytime the body gets a shock for any reason, things reset. Because when you're depressed, there's a feeling of withdrawal, loss of self-worth. Some people even feel suicidal. You can't concentrate when you're depressed. Let's say I give you bad news now, I tell you your house is on fire. you can't focus and do a math calculus you could normally do before. The whole brain has gone into preservation mode. It's like shock, disbelief, what to do and how do we handle this. And so loneliness could be, for various people look stoic, but being so you can even be alone amongst people.
Yes.
So loneliness is not necessarily people dependent, but obviously when all the people who you knew in life, your mates, people you talked about, they're all going. There's a younger generation you can't understand. And those relatives, in fact, some people are even waiting for you to die to take your property. You know, things like that. You start realizing that, you know, that could be a problem. And by the way, also there's the effect of aging on the caregivers, the younger people too, because people could focus on the old person getting old, but the younger people with older people also have issues too.
Okay.
One of it could be depression. First of all, let's say this is your father, your mother, or somebody who you held dear. They were like the lions. They give you advice. They were your source of strength. And now they have Alzheimer's. That's not the same person you knew before.
Yes.
And then you can't even bring them out. This person you used to boast about now is walking around naked. They can't hold their urine. They're always walking with a cane. They're not looking like Hercules anymore. They're now looking more like, or they're on a wheelchair. You know, so for them it's difficult
That transition. Yes.
Because this is not the person they know, even though the physical body is the person they know, but that's not the mind they know, that's not the bright, so they can't go to that. Secondly, if they don't have people to assist them, then they'll have to give up holidays, give up their life, give up work, make excuses. So almost like minding a brand new child again, to make sure that the parent or the uncle or whoever is well taken care of, unless you have resources to afford caregivers. And then sometimes those people, some tend to even forget that those people are not even able to respond the same way. It's not the same person. So you find you're trying to help the person, you finish tidying them and they mess up the bed again, or they refuse to dress up. You're trying to take them to church and they start fighting you and so on. And then it leads to frustration. And if you do not properly counseled and trained, educated, or have your own support system, it leads to things like elderly abuse or neglect or dumping and so on. And that, to that elderly person, if they're still cognitive, they get even more depressed. Look, what I'm a nuisance, or these people don't love me anymore. So it's a whole. It also could affect the younger person at their workplace because they are taking too much sick time, they look incompetent. It could also even affect their marriage. Someone brings in a parent into the house, and then the other half of the family say, I have to deal with that too. Is your mother, is your father? And then, so even that elderly thing is going to affect other, it's a whole thing.
So that chain reaction.
So that people have to really think about this and plan. Okay, and some advice I'll give is,
well, unfortunately, it looks as though we are out of time. But I would want to invite you back to our program next week, where we'll continue in it, and we could probably kick off with that as to what are some of the advice you could give to caregivers of aging people. I think, and that's a whole program by itself. Right, I've been speaking with Dr. Ogana Okeke. He's a specialist, a medical doctor, and we've been talking about aging and health. I'm Michael Stewart. Make sure you tune in next week for the continuation of this program.